Okay, I think we'll get started. We've got a lot to get through today. We'll begin just with some housekeeping items. I want to thank you all so much for joining us today. My name is Marley Furman, and I'm the project manager for Akoya at Akoya for HRSA's donation campaign. The housekeeping reminders: this webinar is being recorded, so if you do not wish to be recorded, please disconnect now. Additionally, please keep cameras off and mics muted unless you are one of today's featured presenters or asking a question during one of our designated question and answer periods. You are welcome to drop comments and questions into the chat at any time. And now I would like to introduce Lauren Derensberg from HRSA's Division of Transplantation to kick off today's webinar. Lauren.
Thank you very much, Marley, and good afternoon, everyone. Welcome to the Health Resources and Services Administration's Donation Campaign Share the Love Donor Day 2024 webinar. I also am so happy that you all could join us. We have a great lineup for you all today. We're going to feature presentations from donation partners who model creative approaches to celebrating National Donor Day. We hope you find inspiration that helps you reach your donation campaign goals and earn HRSA recognition. As Marley mentioned, I'm Lauren Derensberg. I'm the lead public health analyst with the Division of Transplantation in the Health Systems Bureau at HRSA. We're also joined by our Akoya team members, Marley, who you've met, and Bree Hennessy, communications consultant. HRSA's Division of Transplantation is our nation's unifying voice for organ, eye, and tissue donation. By creating a larger, more diverse donor pool, we can help more people find matches for life-saving transplants. National Donor Day, which is celebrated on February 14th, is an important opportunity to unite in support of patients on the national transplant waiting list and improve their chances of finding a match. It's also a day when we honor those who have selflessly donated organs, those who have received an organ transplant, and those who were unable to receive a life-saving transplant in time. I know that everyone is stretched thin, and many organizations have experienced leadership changes, and people are often working with limited resources in these days and times. So we are very appreciative of your support of the donation campaign and observances like Donor Day, despite all of the challenges and other priorities you have going on. Collectively, your efforts have helped to sign up more and more donors each year, and you continue to change and save lives. I know competing priorities can make attending events a challenge, so thank you again for making the time in your busy schedules for today's webinar. We're going to begin this session by spotlighting new campaign materials that partners can access and now and in the upcoming months, from shareable graphics to a new resource video. Then, the bulk of today's webinar is going to be devoted to presentations from our featured donation OPO partners. First, we'll hear from Tennessee Donor Services about Donation Donor Day activities at a Level 1 trauma center. Next, Lifeline of Ohio is going to share how their top performing partners earn platinum recognition in part through their Donor Day activities. Then we're going to hear from Versity about their approach to organ donor outreach and engagement on Donor Day. Now I'm going to hand things back over to you, Marley, to get started with today's presentations. Thank you.
Thank you, Lauren. To start today's webinar, let's dive into the latest donation campaign resources. In response to questions that we received from partners during the scorecard submission process last September, we've developed a new scorecard resource video, How to Use the Donation Scorecard. This video walks through downloading, filling out, and submitting the donation campaign scorecard to ensure that partners receive their hard-earned recognition. This is a great resource to review before submitting, and we hope that partners will keep this video in their digital back pockets as they participate in this year's campaign. You can find the video on HRSA's YouTube channel in the Donation Campaign playlist. If you haven't reviewed that playlist, be sure to check it out. It has prior webinar recordings as well as other resource videos to support your campaign efforts. Recently, we released our newest issue of Digging into Donation, our newsletter for organ donation professionals. This issue features best practices for campaign goal setting, information about Donate Life America's custom donor registration links for tracking registrations attributed to your campaign efforts. It also has an interview with Morgan Reed of the National Kidney Foundation that's packed full of tips for incorporating kidney transplant and living donor education into your donation activities. More about that from Bree in just a minute. We distribute this newsletter via e-blast to organ donation organizations on our mailing list. So if you didn't receive this month's issue, please reach out to donation@akoyaonline.com to make sure that you're added to the mailing list. We are always looking for new topics to discuss and new partners to spotlight. So please let us know what you would like to see in our next issue. I will now hand things over to Bree, who will tell you about our newest donation social media graphics.
Thank you, Marley. So we are very excited to share our newest suite of Valentine's Day themed graphics, which are just in time for Donor Day on February 14th. Right now is the perfect time to download and share the graphics. They are available in English and in Spanish, and you can find them right now in their own album in the Donation Campaign Facebook group or in the Outreach Materials Library on organdonor.gov. If you or your partners are looking for a simple way to boost your scorecard points, please remember that you can earn 5 points for each graphic that you share, and then another 5 points for each platform that they're shared on. So for example, if you share all 3 Donor Day graphics on your workplace's Facebook, Instagram, and X page, you have the potential to earn upwards of 70 points. So sharing those graphics is a really great way to boost your scorecards. We love to know when your workplace shares donation campaign materials, so please don't forget to post directly to the Donation Campaign Facebook group. And we also encourage you to tag organdonor.gov or HRSA's Spanish language site when sharing your posts. Also, if you're displaying any of our printed materials, like our certificates, barometers, or posters, please share pictures with us because we are always looking for materials for new partner spotlights. We have also created a suite of National Kidney Month graphics to amplify the importance of kidney donation and living organ donors. Keep an eye out for this suite, which has not debuted yet, but which will be released in the Facebook group next month, and then in the Outreach Materials Library in March. All right, thank you, everyone. I will now pass things back over to Marley, and she has some final remarks before we jump into our guest speaker presentations.
Thanks, Bree. Before we begin our featured Donor Day presentations, I just want to reiterate Lauren's sentiments about our appreciation for your participation in the donation campaign. We have been meeting with multiple OPOs across the country, different donation organizations, and with the Donation Planning Committee, and we have heard of the stress around CMS metrics and the time and effort that our partners are carving out to dedicate to donation. Please know that we are here to offer any guidance and assistance that you may need, and we are actively working on a series of new resources and campaign adjustments to make using donation materials and earning recognition from HRSA more achievable than ever. Please reach out to us if you have requests or ideas that would make it easier for you to participate in donation. We want your feedback. Tell us how we can make your lives easier. Thank you for your continued support and your tireless efforts. Now, with Donor Day just around the corner, we have a few presentations lined up to show you what participation can look like. With that, let's welcome our first guest speaker today from Tennessee Donor Services, Lindsay Foster, Donation Specialist for TriStar Skyline. Lindsay, take it away.
Hi, everybody. Thank you so much for having me. My name is Lindsay Foster, and again, I work for Tennessee Donor Services. I've been with the company now for about 2.5 years. And just to give you an idea of our service area, we serve 132 hospitals and 4 transplant centers. And as far as volume, last year we had 506 organ donations. So I'll have Marley drive my PowerPoint. So next slide, please. So today I'm going to talk with you about ideas on how to just personalize Donor Day for your entire service area using impactful visuals and then positive messaging as well for your hospital partners. Next slide. And next slide. So I don't know about you, but I always love treats, but our medical teams in particular really love treats. In particular, they love chocolate. But here are some ideas of treats that we have delivered to our hospital partners on Donor Day for the last couple of years. We begin with brainstorming with our hospital development team and working alongside purchasing to get these bulk orders in place. We then use our hospital managers or our hospital liaisons just to get a head count to ensure that we have enough treats for day shift and for night shift too, because we cannot leave out our night shift people. Once these orders have come in and the bulk ordering is in our house, then we will line up volunteers through our external affairs program, and then we will work on assembling all of our goodies. Once they are assembled, our hospital development coordinators will then distribute them to their respected hospitals. And we utilize these during rounds to show our faces and to meet the nurses who are doing all of the hard work in making donation a possibility. So as you can see here on the left side, we had a bulk order of cookies. We attached some Mylar Donate Life balloons to those. You can't see it in that picture, but they are there. And then we had a handwritten thank you card on the cookies, just thanking the staff for all of the hard work that they do. And we focused our attention to our ER staff, our OR staff, and our ICU staff. We then had a customized flyer attached to that as well. And I'm going to go a little bit more into the flyer here in a little bit. The middle picture was just a small token of appreciation for Donor Day. We included the Donor Day sticker on the box, and then it just had some small little chocolate hearts because Donor Day also falls on Valentine's Day. And so we utilized those red heart chocolate treats in those little baskets. And then on the right, we have a little goodie bag that we assembled for our nurses and medical staff. And it had our clinical trigger cards that they could attach to their badges, as well as a mini Sharpie that had our phone number on there for referrals, and a pen, as well as a chapstick, because if you know, being in a hospital, all of the oxygen, your lips get really dried. And so the nurses really do love that chapstick. And of course, some treats. There's some candy in there as well. But all of these we delivered across our service area because, as you guys know, there are a lot of nurses who do local traveling and a lot of nurses who pick up shifts at different hospitals. And so we never want any hospital to feel less than or left out. We'll go ahead and go to the next slide. And we'll talk about this flyer that was customizable to all of our hospital partners. So we had our graphic design team create a blank flyer, and our hospital coordinators would go in and input our hospital name, and then we would also put the hospital data for the calendar year prior to that. These were displayed on the cookies, but then we also sent these in email format to our key stakeholders within the hospital. So our CEOs, our CMOs, our ACNOs, our hospital liaisons, our marketing teams. And a lot of these hospitals really utilize these flyers in highly populated staff areas to celebrate all of the work that had been done for donation in the previous year. So elevators, for example, break rooms, and then also the hospital used video boards, like virtual video boards, and displayed these numbers as well. And it was really just a great way to celebrate all of the work that had been done. And it was easy to customize this for our team for each hospital. Next slide. So next, we're going to just talk about some impactful visuals that you can use throughout your hospital. So we really love to use visual representations for the organ donors for that respected hospital, but then also the lives that were saved. So maybe that side of donation that the hospital doesn't always see. It really just creates a very pretty picture outside of the main hospital entrances. As you can see on the left here, this hospital used the use of pinwheels for the number of lives that were saved through donation and the flags for their organ donors. We've utilized large flags, small flags, pinwheels, and we cluster them together. It just makes a really great visual representation of all the work that has been done. We also use signage throughout the throughout the display as well. And it just explains what the representation is. So some hospitals choose to put the QR code to sign up to be a donor on that sign as well. But it's just a great way for anybody who's entering that hospital, whether it is hospital staff or somebody that is visiting someone who is ill, or maybe they have a doctor's appointment there. It's just a great way to get the community involved as well. Next slide, please. Over the last several years, we've seen a really large increase in lighting up local buildings. And a lot of our hospitals have actually jumped on this bandwagon. And it really creates a beautiful picture at night and is quite a conversation starter in the community. People, as they drive by, notice that a lot of different buildings are lit up in the same color. And it generates a lot of questions. Well, why is that? Why are they all in this color scheme? A lot of our local stations, news stations as well, will do still shots of certain bridges or certain buildings and announce that it is in honor of Donor Day or National Wear Blue and Green Day. And it's really just as simple as asking the hospital if they have these capabilities, or asking local buildings, hotels. I know this has become very popular with some hotels as well, and just asking, would they be able to light their building up in blue and green just to create that awareness? But it creates such a beautiful picture at night, as you can see from these pictures. Next slide. Balloon arches and number balloons are great ways to represent, to get people's attention, but also to represent the number of donors in your hospital. So always check with your facilities to make sure they allow latex balloons. There are some facilities that do not, but if they do, latex balloon arches are a great visual over tables or entrances to ceremonies. I would suggest to invest in a balloon pump and a lot of patience, and maybe recruit a lot of people, because these, as you can imagine, or if you've ever experienced these, can be very time consuming, but they are great photo backdrops, and they really are great to look at. If that is not feasible, or if latex is not allowed, using a Mylar number balloon is also a great option. They're good conversation starters. This was actually myself. I was at a table right outside of our cafeteria, encouraging people to sign up to be an organ and tissue donor. We had brochures, we answered questions, but really many people approached me and said, well, what is the 43? And I explained to them that that was the number of donors that the hospital had in the previous calendar year. And it was just a really great conversation starter and very easy to do. I just got approval from the hospital to set up that table. I try to set that table up several times throughout the year, and then especially during Donate Life Month and Donor Day, just to answer questions for anyone who is moving through that cafeteria area and may have questions about registering to be a organ, tissue, and eye donor. Next slide, please. Now, this photo was actually taken from Blue and Green Day, but this idea would also translate to Donor Day. This hospital in our service area had a beautiful ceremony to honor donors and transplant recipients, because they do have a transplant program. And so they planted a tree in their hospital garden, and they invited families of donors and recipients to place these rocks around the tree in remembrance of someone or in celebration of a life-saving gift. And this was collaboratively organized by their Organ Donation Advisory Committee, Pastoral Care, their transplant team, and Tennessee Donor Services. And this went over really well. The tree was actually donated by their foundation at the hospital, and it was really a great way to honor those who had donated, and then also for them to meet people who received transplants. So they got to see both sides of this beautiful story, and it went over really, really well. And I loved the sentiment of the rocks. And they plan to do this year after year when they invite donor families and transplant recipients to these ceremonies to continue to add to that collection, which I love. I think that is great as well. Next slide, please. So positive messaging, just turning a tragic situation into something that is uplifting. I mean, what could be more uplifting than a fuzzy little friend here? So many of your hospitals probably have therapy or support animals. And so we love to utilize these guys in rounds, using special photo backdrops and photo opportunities and celebrations such as Donor Day. We will bring the props such as the bandana that you see, the little badge pulls, the little flags, and then we get blue and green toys. And then, of course, we have to have some treats that we dangle back behind the camera so that they sit still. But really, the nurses and the doctors and all the community members that are in the hospitals really love taking pictures with these guys. And it's just a great way for people to approach you and to start some conversations and also to celebrate. Next slide. So last year at my hospital, we really wanted to acknowledge the nurses who made that initial phone call for an organ referral. So the message was that there were so many calls that were made to the organ procurement organization, but only a very small percentage of those went on to be organ donors. And it really just visually showed the rarity of the gift, yet the importance of that single one phone call that they made. So during this ceremony, the ACNO and the Tennessee Donor Services representative, we presented the nurses with a special pin that they could wear on their badge. And the idea stemmed from the Daisy pin, if you guys are aware of that. But we wanted something that it would be rare, but a conversation starter, yet a positive recognition for the nurse who started that entire process of donation. So ahead of the ceremony, we worked with our graphic designer in purchasing on developing and ordering this pin. And then we used our data to collect the names of the nurses who made those phone calls for those who went on to be organ donors. Our hospital marketing team is wonderful. And they collaborated with all of the unit managers on formal invitations to the ceremony to ensure that they weren't on the schedule that day, or if they were on the schedule, that they had coverage so that they were able to attend the meeting. And then we also invited local news coverage and donor families to the ceremony, which was organized by the hospital marketing team and our external affairs department. And this went over really well because it was just a great positive recognition. It made these nurses feel super special. And it's something that they wear proudly on their badge every single day when they come to work. And I'm actually wearing ours right now. As you can see, it's very small, but also very impactful and something that these nurses want. So, I've had many nurses that have come up to me and say, I want one of these pins. How do I get one? And so it's a great conversation starter with the medical team. Next slide. And then another thing that I would love to encourage you all on is just ways to implement donation in events that already exist within your hospitals. So these pictures were taken from a Trauma Survivors Day dinner. Now, I know what you're probably thinking, which is probably what I was thinking, a survivors dinner to honor donors. Yeah, I wasn't sure how this was going to be taken, to be honest with you, but the trauma team reached out to donor families from the previous year, and they asked if they wanted to be in attendance and if they could honor their loved one. It was actually really remarkable. Not only did we have some of the donor families that came to this dinner, but we also had some of the local recipients who had received these organs that these families had connected with. And the recipients were able to thank the doctors and the nurses for maintaining that opportunity for donation. On the right, the picture where I'm standing in the middle and there's a female and male on each side of me, this was actually a mother and father of one of the donors. They spoke beautifully at this dinner. And they wanted to be there even though it was 2 short months after they had tragically lost their 15-year-old daughter. But they wanted to be at this dinner to honor her, but also the mom is a kidney recipient, and she wanted to thank everyone who was there for coming to honor her loved one and to encourage them to be organ donors because of the healing it had provided her with losing her daughter, but then also because it was celebrating her and her life. This was completely organized by the trauma program. I was simply there just to offer my condolences and support to these families. I had worked alongside many of them during some of their hardest days. But I really encourage you to look at some of these ceremonies and celebrations that are already organize within your hospitals to see where donation might fit, especially for your hospitals who may not have a transplant program and may not see that other side of donation. Next slide. I've also attached my email. So if you have any questions, please feel free to reach out to me. I'm happy to help you in any way possible to help streamline things seamlessly across your service area. But thank you so much for attending today, and thank you so much for your time.
Thank you so much, Lindsay. And there was just one question in the chat early on in your presentation that asked, what was the rough budget for treats?
So really that depends year to year on our budget because of, like I said, we have 132 hospitals. And so I cannot give you those numbers. I can have our purchasing look into that. But it does vary from year to year, just based on what we have done in previous years before that. And we obviously want to be good stewards of our budget as well. So I will get back to you on that.
Thanks, Lindsay. Any other questions for Lindsay? Feel free to unmute yourself and ask if you have any questions at this time. Okay, her email is there if you'd like to follow up after today's webinar. And up next, let us welcome Jessica Williams of Lifeline of Ohio, who's going to be joined by Jeremy Doherty, Surgical Nurse Manager at Mount Carmel Grove City Hospital. Take it away.
Hi. Yeah, hi everyone. Good afternoon. My name is Jessica Williams. I'm the donation program coordinator at Lifeline. I'm just really excited to be here and share more about how our organization is leveraging the donation campaign. So next slide. So as you all know, the campaign is the key component of what we all do as an OPO, right? Save and heal lives through the gift of donation. And so we definitely feel that this platform, we're able to give this resource to our external partners so that they can bring awareness to donation. And it also gives us the ability to recognize those partners that go above and beyond or create or maintain that culture of donation. And then in addition to that, it supports the frontline staff members that are on site and attempting to build relationships with our partners, ultimately saving more lives, right? So next slide. In 2023, we actually were honored to recognize 16 different partners for their education and their awareness efforts because of the donation campaign. So our personal goal as an organization is to increase that number to 20 participating hospitals in 2024. Next slide, the Lifeline, we cover 38 counties in Ohio and then 2 in West Virginia. So within those counties, there are extremely large hospital systems, and then we have our smaller hospital systems, right? But it was actually one of our medium-sized hospital systems this year that earned the most points and received the platinum recognition. And the next slide talks a little bit about what Licking Memorial did to earn those points. And some of the really cool things that they did were like holding a program with their transplant recipients and donor family members to talk about the importance of the registry. They included donation as a part of their employee orientation. They held registration tables throughout the year. They had a holiday event, in December. And then we have our annual Dash for Donation that they were able to participate in and create a team to, of course, bring awareness. And then they also were able to post stories on social media and on their website and within their intranet platforms. So obviously I could talk all day about the incredible staff at Licking and their advocacy, but I did want to just give a special shout out to Lisa Hayes. She's the director of acute care at this hospital, and she has a personal connection with donation and is passionate about helping create that positive culture. So as many of our other hospital partners do. And so I just wanted to give her a shout out. And next, we're going to talk a little bit about some of our other hospital systems and what they've done, and hoping that you can maybe give those ideas to your teams. So Trinity Health is a hospital in Steubenville, Ohio. They held a Facebook Live event this year during Spirit Week and invited our Chief Operating Officer to participate and answer viewer questions. There was also a donor family member that was invited and decided to share her story on that platform. And it was, of course, extremely moving and impactful for everyone that was able to listen in. And then next, we had Nationwide Children's Hospital in Columbus, Ohio. They planted pinwheels in front of their campus to honor their pediatric donors. And then following that event, they had held a blue and green event where they invited donor family and a recipient family to speak at this event, amongst a lot of other cute things like having a superhero day and food trucks available to their staff that work so hard to create this positive culture. And honestly, what's really cool is that our organization, and sorry, next slide. Our organization has so many ambassadors that are volunteering to speak at flag raising ceremonies or host the information tables, because a lot of these family members are, or I'm sorry, a lot of these volunteers are either recipients or they're donor family members, and they're extremely honored to just get out in the community, talk about their loved one, share more about what their journey has been like, and just show appreciation for the staff that stopped by and talked to them. And that's really the key, right? The stories. Like, I listened to Lindsay's story and that really stuck with me. And so people love stories. We, by sharing different stories, like recipient stories, donors, people waiting for these life-saving gifts, obviously that is going to show the incredible impact that donation has. And then it makes it really, really relatable and real to people. So next slide. I just encourage everyone, whether it's through a story on your internal communication or a social media post or even a video, sharing those stories is the best way to spread the message of donation. And actually, another way, I saw someone mentioned it in the chat. The next slide talks a little bit about local media and how some of our smaller hospitals were able to successfully pitch to their local television stations and gain some coverage of different flag raising ceremonies and stories about, local donors and the impact that they have had. I think so much of the activity around Donate Life Month is in April. However, we're encouraging our partners to have this same energy throughout the whole year. So there are things like having families speak at orientations or hosting those holiday parties that are going to keep that ongoing message within a hospital system. And another way, next slide, that we have tried to keep, I'm sorry, I think one more slide forward. Another way that we've been trying to keep donation at the forefront of everyone's mind is just by having a scorecard that we can pull in some of the donation activities. So for example, once a month, where the coordinators are meeting with our assigned hospital partners, and we're encouraging them to have these conversations with their leaders in regards to what activities they have. And so we're asking them to include that in their donor councils. And we really just feel that if they are able to take this to different leaders amongst the whole system, that they'll be able to influence champions of donation. And so for 2024, we have worked on portions of our own donation scorecard, and have incorporated that into our strategic plans. So we're working to overall just create a culture of donation and make it easier for the hospital partners to implement it, all the activities. So we, as a system, have created this scorecard so that it has some donation activities, but also some process activities that they can earn points for. So sorry, next slide. So I have actually brought one of our big champions of donation with me, Jeremy Daughtry. He is the surgical nurse manager at Mount Carmel Grove City, and he serves on our medical board, but he's also my liaison. So he's going to share a little bit about what he's done in his hospital and ways that he has influenced, some of these really cool activities and influenced some leaders to have that buy-in. So, Jeremy?
All right, can you hear me okay?
Yep.
Great, thank you. If you go to the next slide.
Mm-hmm.
So just to kind of give you a little setup, Mount Carmel Health System, we're comprised of 4 hospitals within our system. We have 3 primary care hospitals, and we kind of have a specialty orthopedic hospital. So one of the things that I noticed is the families, with the donation process, once that their patient enters the door, they're just kind of left, with that sense of what just happened. So I was talking to my wife, this was coming out of COVID. And one of the things we talked about is, having the flags as a flag raising ceremony, not just during the week, but what we incorporated, I make contacts with the family and ask, would you like an honor walk? And if they decide they want to do an honor walk, we have taken it to the next level. We ask, would you like them to be draped in a Donate Life flag? That after your loved one goes to the OR, we will post up outside of our hospital for 24 hours. And this lets everybody on the campus know, coming and going, that we have had a donation on our campus. It doesn't end there. They go out, they watch that flag raise. It gives them a sense and a time to just collect themselves, take in the moment. Then when I was at the bedside, I make arrangements of when that flag is going to be returned. And I've never sent one in the mail. It always gets hand delivered, whether it's at the funeral home in 2 days, whether it's a month from now, whether it's 6 months from now. I keep in contact with these families and hand deliver these items. It comes with a letter signed by me, and to let them know what occurred during that 24 hours and that, this was, us honoring your loved one during that time period. Then taking us to Blue and Green Week, our marketing team, and we call our fans, their food and nutrition services, they had an amazing idea that we have all these hospitals and we used to just do everything separately. We came together as a system. Each hospital selected one donor. So we had one placental donor and 3 donors, one from each of our hospitals. And each day we would have a special meal. We had a flag raising on that campus and in our cafe, and every single cafe within the Mount Carmel system, they shared the same meal. There was a picture of our loved one up there. It gave a little bio. Here's what their favorite meal was. So everybody in the entire system was eating that same meal. We did that every single day at each campus. And then, unfortunately, one of our own colleagues that previous year was also a donor, and she was honored by all of our system as well. So that was truly, I think, the most amazing Blue and Green Week that we've had, to share those meals, share those times with the family, and it gives them a sense of coming back dealing with the situation, knowing that we can go on. And to have family members smiling while they're holding their loved one's picture and bio was just amazing, to bring some, spark of happiness at a very, difficult time. So that was one of the things that our fans did. And then we also have, Lifeline of Ohio volunteers speak at our OR clinical education sessions that we have throughout the year. And again, during our Blue and Green Week, we established our table. We signed up, I believe, over 50 people for our Dash for Donation, including the family that was honored that day. So it's great to connect with them, and they can display that flag at their house. They could display the flag at the funeral home. They will have that for as long as they want. And I think that's real important for them to take away from this experience. That's kind of what we did for Mount Carmel.
Yeah, so as you can see, Jeremy is just one of our amazing hospital partners that has just gone above and beyond to support the families and giving them the platform so that they can continue sharing their loved one's story and celebrating their loved one. So I would encourage you all to find those champions in your hospital and give them all the ideas so that they can run with it. And so if you have any questions, you are more than welcome to reach out. I can put my information in the chat, and we can share some of the things that we've done to promote donation. So thank you. I appreciate you all listening.
Wow, thank you so much, Jessica. I really appreciate what a great presentation that was. And Jeremy, thank you for being here today and telling us your personalized ideas. I mean, that was just really inspiring. It had me tearing up a little bit. So just genuinely thank you for those ideas.
My pleasure. Thank you.
Appreciate your time. Okay, last but far from least, let us welcome Nicole Badura, Hospital Development Liaison for Versity. Nicole, the floor is yours.
Thank you, Marley. And Jeremy, I think we can all say that we would love to replicate you or duplicate you in all of our hospitals. Awesome work. Like Marley said, I'm Nicole Badura from Versity, Wisconsin. Our OPO, we serve 52 hospitals and 3 transplant centers, one of them being a pediatric transplant center. And I'm going to talk to you today a little bit about our activities for National Donor Day, which is coming up. We've talked about on February 14th. So first, the slide that you see here is a poem that was written by one of our hospital liaisons at Versity for National Donor Day. Roses are red, carnations are pink. To donation, you're the vital link. So on Valentine's Day, we'd like to say, my thanks for all that you do. We couldn't save lives without you. So she wrote this a couple of years ago, and we've used it on an annual basis in our hospitals, part of some of the treats and goodies that we give out at our hospitals on Donor Day. So I did get permission, if you wanted a copy of this, Michelle is okay with that. So next slide, please. So just a list of some of the things that we do on National Donor Day in terms of engagement with our hospitals. Everyone's talked about this already today. You all know registration tables, they're huge. One of the things Versity is really trying to do, our hospital development team, is expand the work that we do for the HRSA, for the scorecard, outside of Donate Life Month, right? A lot of our hospitals are like super involved, super engaged during that month in April with all the activities, but we've been trying to be more creative in terms of expanding outside of that. And National Donor Day is a really great opportunity to earn a lot of those points. So those registration tables, I don't know the exact number off the top of my head, but I know that we have several of our hospitals already planning to participate in registration tables. Most of those tables will have either donor family or recipient family speaking at that table, opportunity to talk to people coming in and out of the hospital about their story and sharing that, and encouraging people to join the registry. We have a couple of our transplant hospitals that actually their food services teams provide cookies for us to have at our outreach tables. I know one of our adult transplant hospital, they provide their donor dot cookies. So our state registry is a orange donor dot sticker on your license. So they have donor dot cookies. Our pediatric hospital is going to be doing heart-shaped cookies this year, frosted ones. So that's fun and great that the hospital participates in that. For us, what we do, like I mentioned with that poem, for our partners in the hospital, we pass out that poem, candy, cookies. We decorate break rooms and lobby areas where the hospitals allow us. We do have really great, I guess, representation from the hospitals, or I guess participation from the hospitals that let us come in and decorate the rooms. So the dollar store is your friend in all of that. So we'd like to hit at the dollar store and find those fun little tchotchke items and decorations that you can use just to make your hospital teams feel, I don't know, appreciated on that day. Utilize the donation materials. This has been talked about, obviously all day today. But really, they are there for you for a reason. You don't need to reinvent the wheel. We saw earlier some of the new releases for this year's Donor Day, the really fun Valentines that you can print out. If your hospital is willing to print them out and share as well, the social media graphics, there are really so many awesome things, and we love to use them as well. The flyers that you can print out. The Valentines are great. We use those in a lot of different areas, and we actually have some of our hospital staff like to get in on the fun and exchange the Valentines with each other. So they'll print them out, or we'll print them out for them in some instances, and they'll pass them out to each other on the units, which is really cute to watch them participate. We'll connect like heart-shaped lollipop suckers to the Valentines to put in the break rooms. They'll be attached to our cookies at our registration tables. I know our volunteer team is utilizing Valentines with some Donate Life stickers and things to have at our tables too. So really great resources that we really lean on. And then just letting your hospital know too, just being participating in all these activities with us, all of the points that they're going to get on the HRSA scorecard for that. Next slide, I just have some pictures, nothing too crazy, but of some of the things we've participated in. One of our hospitals actually has a tree that they keep up and turns into a Valentine tree. You can see on the upper right corner. So just some fun marketing materials that we have, some patient recipient poster stories that we have, some candy, treats, Valentines hanging, printing out the flyers and such. So fun opportunity to utilize that space. On the left side, you see a registration table with some of those cookies that we get. And again, sticker with the either the QR code or registration link for people to be able to join the registry right from the cookie information is right there. And then you can see too that Valentine that or the Valentine poem that we put on Valentine cards that we've used in the past. All right, and any questions for me on other activities that we do or we participate in for Donor Day? And that's all I have. Thank you so much.
Thank you so much, Nicole. Any questions for Nicole or any of our presenters? Anything about donation? We have a few minutes, so we can answer questions, or if anyone else has additional suggestions, ideas they'd like to share, we'll be happy to accept those now.
I have a question for Nicole.
Go right ahead.
Did you say that we had permission to use that sweet poem that are we allowed to use that, or do we need to get permission or anything?
You can use that, yeah, and I can try to get it in the chat really quick. Otherwise, Marley, I assume this is going to be sent out, the recording, so people can kind of maybe zoom through, or if you have the slides.
Yeah, we do. We always post the recording online. It will not be available ahead of this year's Donor Day, however, but we can send out a PDF version of today's presentation. If you just send an email to donation@akoyaonline.com, we'll be happy to share that with you.
Thank you. I actually took a snapshot with my camera.
Oh, perfect. Yeah, say take a screenshot too. Yeah, I can. We can go back to it.
I've done these applications and I've done it a couple of times today too. There are a lot of really great ideas, and I love being able to share all of that. So,
absolutely.
Thank you so much.
Sure.
Anything else right now? Questions? Other ideas? Okay, we are always available for any general HRSA questions. You can email donation or donation@hrsa.gov. And then for anything specific to the donation campaign, you can reach us at donation@akoyaonline.com. And we'll be happy to answer questions via email or to schedule a coaching call. We can't wait to see even greater uptake of our donation materials like our rack cards and our posters as we get into the second year of our rebranded campaign. Please don't forget to take pictures and send them to the email on the screen here, or share them directly to the Do Nation campaign Facebook group so that we can celebrate you. With
Marley?
that, we wish. Oh yes, sorry, Hillary. Go ahead.
Hi, I just wanted to, I saw something in the chat that I thought might be worth
Yes.
bringing forward. It was from Elizabeth. She said she had been getting pushback while utilizing some of the graphics from Donate Life and Do Nation from their Office of Public Affairs this year. Any ideas on how to overcome this? I didn't know if maybe Elizabeth had a little more information, or that might be helpful to others too.
Sure. Yes. Elizabeth, did you want to add anything else? Otherwise, I can respond.
Hi, this is Elizabeth Story, and I work at a VA, and so it may just be VA related, but I've been working on the organ donation campaign for 5 years, and this is the first year I've come across the Office of Public Affairs not wanting to share other people, I guess the Donate Life and the Donate Life and some of the donation graphics and stuff in the toolkit. I've always made posters and presentations using that stuff, and I've gotten pushback that it's not, that it's proprietary and it's copyrighted and it's this and that and the other. And I send them all the stuff that I get so that they know where it comes from and how it's supposed to be used. So I just don't know if somebody has some information on how to combat that. It's stifling my creativity this year.
Yeah.
I'm sure. So we can assure you that anything Do Nation is not copyrighted, in terms of you're welcome to share it without providing getting it special permission or getting extra authorization of any kind. They are developed to be shared by our partners on their platforms. We are working on developing and making available more materials that could be co-branded. So you can look for further information about that in the future. I don't know if Hillary wants to speak to the Donate Life materials.
I would just, say the exact same, Elizabeth. And if it's helpful, I dropped my email in the chat. If it's helpful to give to your folks to talk through anything, if they have any questions, they can absolutely reach out. And thanks for raising that.
Yeah, and likewise to us, we'll be happy to speak with anyone if they have any concerns.
I appreciate that. Thank you.
Of course. Anything else? Okay. With that, we wish you a great Donor Day on February 14th. And Lauren Derensberg, would you close out today's meeting?
All right, absolutely. This is a great meeting today. Lots of great information shared. I hope you all find it very helpful as you continue to plan and implement your campaigns this year. I want to once again thank all of today's speakers for sharing your experience and expertise with us. And thank you to everyone who was able to join and make time for joining and helping to advance HRSA's Do Nation campaign. Your involvement is really what makes Do Nation work, and we're so grateful for your ongoing support and commitment. You can always reach out to us at donation@hrsa.gov if you have any questions about the campaign. You can also email donation@Akoya online. And don't forget that Marley and Bree are always available to have a one-on-one call with you should you have any specific questions or want to talk about your specific campaign. If you haven't already, please encourage your OPO and you yourself to join the Do Nation campaign Facebook group to ensure that your social media manager can view and access Do Nation campaign graphics, materials, and messaging. And please stay connected with HRSA. We're on all of the social media platforms. We encourage you guys to follow along and share our content as well as your content with us on Twitter, Facebook, LinkedIn, and Instagram. We also encourage you to sign up for HRSA's e-news, which is a bi-weekly email of comprehensive HRSA news, and sign up for our press releases to keep informed on what's going on policy-wise at HRSA. You can also visit our website, hrsa.gov, for more detailed information about all of our programs. On behalf of HRSA and myself, thank you very much for taking the time to join us today and for your work as donation partners. We wish you success in the campaign and a wonderful National Donor Day. Thank you.
Thanks all. Bye.